A 73 years old male present with collapse and brought to the emergency department. On examination, he has cold painful left hand and also the forearm. What is the most likely cause? Here the options are occlusion of the brachial artery due to atheroma, occlusion of the axillary artery due to atheroma, axillary vein thrombosis, cervical rib, brachial artery embolus. So what may be the cause? And for this cause, there is cold painful left hand and forearm. That means this area, hand and forearm, this area is cold and painful. So what would be happen? It usually happen there is blockage in this area. So we have to know the name of this artery, and here we can see the name of the artery is the brachial artery. So there is definitive brachial artery pathology. For this condition, distal to the brachial artery, which is the forearm and hand, is affected. So the brachial embolus, let's see the brachial embolus. 50% of the upper limb embolus will dislodge in the brachial artery. 30% of the upper limb emboli will dislodge in the axillary artery. So brachial artery is most commonly affected, and the axillary artery, when there is axillary artery embolus, that means in this area, in this condition, pathology also present in the arm area. And sudden onset of symptoms such as the 5P, pain, pallor, paresthesia, pulselessness, and paralysis. That means 5P, pain, pallor, paresthesia, pulselessness, paresis. And the source usually from the left atrium due to cardiac arrhythmia, mainly atrial fibrillation or mural thrombus. The cardiac arrhythmia may result in impaired consciousness in addition to the embolus. So the patient becomes sudden fainting due to the cardiac arrhythmia. In acute condition, there is no time for development of the collateral circulation, so the limb becomes very pale and very painful. So this is very important. In case of the acute case, it is not possible to development of the collateral circulation, and the emboli usually occurs as a result of the atrial fibrillation. Fast atrial fibrillation can cause syncope and acute embolus. And atheroma in the upper area is very rare, and in case of the atheroma, it is developed gradually. So in this condition, collateral develop, and the symptom usually very less. So what is the answer? The answer is the brachial artery embolus. Why there is brachial artery embolus? Because the affected area is the forearm and hand, and just proximal to the forearm there is the brachial artery, and become cold and painful. That means the acute condition, and acute condition developed due to embolus. And in case of the atheroma, usually symptom developed gradually.